press meet. I'm sure you all have a social responsibility and duty to create awareness about the cancer, especially head and neck cancer, which is caused by tobacco. Usage of tobacco in any form, smoking or chewing, causes cancer of many parts of the body, but predominantly oral cavity, throat, and food pipe. And today we are emphasizing the importance of oral cancer because it is easily diagnosable. You can see this standee. By self-examination is quite possible. They can look for any ulcer or white patch or a reddish patch in the mouth or any swelling in the neck that can easily make a diagnosis of head and neck cancer. I think this creation of awareness is very important because early diagnosis of cancer is curable. In general, cancer can be prevented by primary prevention and secondary prevention. Primary prevention is leading a healthy life, taking healthy food, avoiding tobacco, alcohol, and improving the immunity by regular exercise and consuming fruits and vegetables. So this way, definitely you can prevent the development of cancer by leading a normal, healthy life. But secondary prevention is one where the person develops cancer, but it can be diagnosed in the early stage. So a screening is important, and the awareness of cancer is an important thing for which we require your part to create awareness among the public about the cancer incidence, especially the damage caused by tobacco for the body. As far as VS Hospital is concerned, we have been conducting many camps and we are doing lectures in schools, colleges and in corporate institutions where we target the younger population so that they can send the message to their parents and relatives. And we do also run camps to detect early diagnosis. And recently we have a memo bus where we go to various parts of the city and not only look for breast cancer but also uterine cancer as well as other common illnesses like oral cancer. So, and we do CMEs, continuing medical education for the general practitioners, doctors, so that they are aware of the cancer incidents. Because many, for example, when a lady goes to a lady doctor and says that she has a lump in the breast, invariably they say, not to worry, it's only a benign lump. So we have to create awareness among doctors also about the incidence of cancer. It's growing. So, and by this we reach many sections of the society so that they are aware of this cancer problem. And today we come to you so that you can create awareness among your audience, about this oral cancer, because it's easily diagnosable. It is caused by the tobacco as well as alcohol and bad oral hygiene, and it can be preventable easily and easily diagnosable, and only it is easily diagnosed, it can be cured. So that's the idea that we have called you for this meet, and I request my colleague Dr. Nithya to say a few words about the oral cancer.
Incidence of cancer is on the rise. So, and as we know, more than 50% of human cancers are caused because of tobacco, because of either smoking or because of tobacco consumption. So, being so important cause of cancer, it is very important that we encourage people to give up the habit. Since it's a no tobacco day, we would encourage all the people to understand the health effects of tobacco and quit tobacco as soon as possible. It can be quit at any stage. The benefits are visible at any stage of quitting, and the risk of cancer comes down only after about 15 to 20 years. So it is very important to quit tobacco today to prevent any other complications. It is not just cancer, tobacco also causes many other problems like heart attacks. So it is important that tobacco should be quit. About oral cancer, it is a very common form of cancer in India, and because of the indigenous habit of tobacco chewing, we get a lot of cancers in the oral cavity, which includes the tongue, the cheek, and the throat. So, as sir was saying, it is visible, the changes are visible because you know what happens in your mouth when you brush your teeth, when you rinse your mouth, you know that there is something abnormal. So whenever there is something abnormal that you feel in your oral cavity, the mouth as you commonly call, please see your doctor immediately. It could be a dentist, it could be a surgeon, it could be a family physician. Ask them to examine the oral cavity with the help of a torch. Find out what is abnormal. So the early signs of oral cancer are white patches, red patches, which are commonly called as leukoplakia or erythroplakia. These are conditions which may lead to cancer in the future. So these changes have to be followed up, and if it is because of tobacco, they have to be addressed immediately with the intention of quitting tobacco. So these are early signs of cancer. The other important cause of cancer in oral cavity or the tongue is the sharp tooth, which nobody talks about very frequently. Apart from tobacco, people who never use tobacco are also prone for oral cavity or tongue cancers when they have a sharp tooth. How does sharp tooth happen? The enamel in the teeth gets eroded over a period of time because of wear and tear. So when it gets eroded irregularly, there is a lot of chance that the tooth might become sharp and it might press into the surrounding cheek or the tongue. So these changes over a period of time may lead to cancer. So that is also an important cause of cancer, and to prevent this from happening, we generally recommend annual dentistry, meaning go visit your dentist, ask them to examine the teeth, find out if there is any sharp tooth around. If there is a sharp tooth, we have to definitely make sure that the tooth is raised. It should be softened so that it doesn't cause any kind of injury to the cheek or the tongue. So this is one important thing. So maintenance of dental hygiene is extremely important. Prevention, yes, good oral habits, good oral hygiene, visit to the dentist frequently, and quitting tobacco is very, very important because the risk does not come down on the next day. It takes about 15 to 20 years for the effects of tobacco to come down and to make the risk of cancer as zero. So quitting today is very, very important. And there are several methods of treating cancer. Oral cancer has come up in a very big way now. There are chemotherapies, there is radiotherapy, there are laser surgeries, there are local radiotherapies, immunotherapy is an option. So there are multiple options available to treat. When diagnosed in a very early stage, oral cancers are highly curable with a minimal chance of recurrence. It just needs an early diagnosis and follow up to lead an active, healthy lifestyle after diagnosis of oral cavity cancers. Any cancer diagnosed early is always curable with minimal treatment. Otherwise, there are multiple treatments needed, like a combination of radiation, surgery, and chemotherapy to treat oral cancers. So simple surgery or a simple radiation might be able to cure an oral cancer in a better way. So early diagnosis is extremely important. So as the standee says, you should be watching your symptoms frequently. It doesn't have any specific symptoms. Watch your symptoms, watch your mouth, watch your tongue. If there is anything abnormal like an ulcer, like a swelling, like a redness, like a white patch, all these are warning symptoms that it could be a cancerous growth. Cancer is not the first diagnosis, but definitely it has to be ruled out, especially if the person is a tobacco user. So if there is anything abnormal, put your hand into your mouth, feel it. If there is something abnormal, please go and visit your physician immediately. That is the advice we have for everyone today. Not all cancers are exposed to the not all cancers are visible. Oral cavity cancer is something that is visible, so it is easy to diagnose. So let us not miss this opportunity, and we advise everyone to act early and to diagnose oral cancer in an early stage rather than going into an advanced stage and requiring very complex therapies.
Generally above 40, but youngsters use pan, gutka, mava. These things definitely affect the oral cavity. Within 2 to 3 years they develop cancer, whereas tobacco chewing or smoking causes cancer after 20 years, whereas this habit of gutka is very detrimental. Within 2 to 3 years they are able to. So we are seeing young people in the 20s and 30s coming with oral cancers, and this type of cancer is again very aggressive and difficult to treat.
So the screening வந்து
ஜென்ரலாக வந்து நாங்கள் பார்க்குற பேஷண்ட்ஸ் நார்மலாக வந்து வாட் வி சி as அவுட் பேஷண்ட்ஸ் ஸ்மோக்கர்ஸ் கொஞ்சம் அலர்ட் ஆகிடுறாங்க, டொபாக்கோ சூவர்ஸ் கொஞ்சம் அலர்ட்டாக இருக்காங்க. வாயில் ஏதாவது புண்ணு வருது, ஏதாவது ஒரு அப்நார்மாலிட்டி வந்ததுன்னா அந்த பயத்தில் நிறைய பேர் வராங்க. எல்லாருக்கும் கேன்சர் இருக்கணும்னு அவசியம் இல்லை, பட் அவங்க மாதிரி பீப்புளுக்கு தான் நாங்கள் அட்வைஸ் பண்ணி ஹேபிட்டை குவிட் பண்ணி அவேர்னஸ் ஸ்ப்ரெட் பண்ண சொன்னோம். இப்போ அவங்க ஒருத்தர் குவிட் பண்ணுறாங்கன்னா அடுத்தது அவங்க போய் குவிட் பண்ணுறதுக்கு தே கேன் ஸ்ப்ரெட் அன் அவேர்னஸ். ஸோ இந்த மாதிரி ஸ்க்ரீனிங்க்கு வரவங்க நிறைய பேர் இருக்காங்க. ஆனால் இந்த அடிக்ஷன் ப்ராப்ளம்னால நிறைய பேரால் அதை விட முடியல. ஸோ அதுக்கு ப்ராப்பராக ஒரு டயக்னோஸ் பண்ணி உங்களுக்கு டொபாக்கோனால தான் இந்த மாதிரி இஷ்யூஸ் வருது, நீங்கள் வந்து அடிக்ஷன் பண்ணி அதை குறைச்சாதான் உங்களால் முடியும் அப்படின்றத அவங்க சொல்லணும், அவங்கக்கிட்ட சொல்லணும். ஸோ தட் இஸ் வெரி இம்பார்ட்டன்ட். பட் ஸ்க்ரீனிங் ஓரல் கேன்சர்ஸ் அந்த அளவுக்கு அவேர்னஸ் இப்போதைக்கு இல்லை. இன்னும் கொஞ்சம் நாள் கொண்டு வந்தால் தான் நம்மளால் முடியும். டொபாக்கோ இஸ் அ ரிஸ்க் ஃபேக்டர் ஃபார் கேன்சர் அப்படின்றது எல்லாருக்கும் தெரியும். டொபாக்கோ சூ பண்ணுறவங்களுக்கு தெரியும், ஸ்மோக் பண்ணுறவங்களும் தெரியும். அந்த அடிக்ஷன்னால அவங்களால வெளியில் வர முடியல. ப்ராப்பர் எஜுகேஷன் அண்ட் அவேர்னஸில் கண்டிப்பாக இதை வந்து கொண்டு வந்துடலாம்.